Hi, this is Dr. George Rogu from RBK Pediatrics, primary care when you want it, urgent care when you need it. Today, I'd like to give you a recap of 2020. What did RBK do during the pandemic of COVID-19? I'll just give you a little bit of insights of what's happened at the beginning of the pandemic, during that pandemic, towards the end, and what's on the horizon. Well, most important thing was that we were here for our RBK families. In the community, unfortunately, in the pediatric world, internal medicine world, because of the pandemic, most offices just shut down. Many people would not test patients for fear of exposure because they had lack of medical protective equipment. It is unfortunate that a lot of medical facilities just gave up on their patients. They would send them to the emergency room, to urgent care, or worse, they would do nothing. Some doctors in our office and staff during this time actually ended up testing positive for COVID-19. Fortunately, each and every case, everybody did well, and they're back to good health. PPE gear and cleaning supplies. Throughout the entire pandemic, RBK always had adequate supplies. Many offices did not, however, and that's why they were forced to close. We had adequate supplies, and we managed to even donate some to the local practices in the community to keep them open for another week or two. And then as Suffolk County rolled out their PPE distribution, we were all able to obtain some protective gear. RBK basically went above and beyond what the CDC recommendations were for office disinfectation. We cleaned and double cleaned the handles, the tables, every single room after every single patient. We were able to manage the well visits and the sick visits by segregating them. In the morning, we did well visits. In the afternoon, we did sick visits. Most important thing is that we eliminated completely the waiting room. With our technology from the EHR, we started the curbside check-in where people would, when they arrived at the parking lot, would announce the office, and when the room was ready, we would divert them to the exact room that they needed to go to, hence bypassing the waiting room altogether. And we were also one of the very few offices that did provide COVID testing to children. Well, we didn't do a lot, but we did enough. During this time, the telemedicine services via Anytime Pediatrics also came to life. We had been tinkering with telemedicine services for medication renewals for ADHD the year prior, but we had a handful of physicians that actually performed these services. When COVID came, we were forced to use more and more telemedicine for acute care service because people just did not want to come to the office. Here you can see Dr. Riley and Dr. Belvin, Dr. Nick, all performing telemedicine, acute care, and medication renewals. We expanded this later to encompass hybrid well visits, and you'll see in some pictures, and then the COVID-19 antibody testing through the telemedicine too. The hybrid visits and the medical tent, that was an interesting one because as time passed on and it was time for the summer checkups in June, people were just apprehensive to come inside the office. They were afraid that they would catch something in the rooms or while walking in the building. Because of this scare, a lot of children, we were running reports and we discovered that a lot of children had become delayed in their vaccines, and that's pretty sad. So what we had to do is RBK had to go meet the patients where they were, outdoors. So we opened up RBK medical tents. We brought out some exam rooms, some teams. We used the telemedicine services to do the talking part of the visit, to go over the medication renewals, what happened with the child from the year prior, order all the vaccines, and then in the medical tent, we would just meet the patient, quickly get the height and the weight, administer the vaccinations, do a medical exam, fill out the paperwork, and off the patient went. That was a very interesting project. As the summer went on, there was talk of, a lot of families were thinking, my child was sick, but he was never tested. I'm sure he may have had coronavirus. So we put out a survey to our parents, asking them, do they want to know? We made a relationship with the laboratory to collect a finger stick specimen from the patient, and we set up some testing down in a parking lot. We set up a couple of parking spots. People would drive in, and our nurses would go meet them in the car and draw their bloods. We did, however, perform a telemedicine medical intake first the week before, where we basically asked the families, why do you want to get an antibody test? The overwhelming response was that they thought that their child had coronavirus at that time, and they were curious. Most of the stories were somebody was sick, the child was sick, they traveled outside, some people were on a cruise. And at each of these sessions that we would perform about 30 to 40 tests, and we would collect the specimens and send them to the lab. Now, what did we learn from this project? We learned that many children had the illness in the spring, and we didn't even know about it. Out of all the cases that we did, we always had about 40% of the cases were positive. But remember that people that came to get the antibody test, very few of them were just curious. Everybody had some kind of a story, and we can determine that by, we did an intake on everybody. So the lessons learned were that many of these children had mild cases. We also learned that entire families were often affected, and children got better in a matter of days. Now, come the fall, we had the back to school PCR testing. I'd like to recap a little bit about what tests were performed, how many were performed, and what our results were. So from February to April 2020, nobody was performing a lot of tests. So we performed 146 tests between the 3 offices, actually 2 offices because one of them became a well visit facility. 49 of these tests were positive. So that was a pretty high number, about 33%. And then from May to June, we performed 141 tests. We only had 6 positives, 4.4%. July, 141 were performed, 6 were positive. August, we performed 55, 1 was positive. So you can see these numbers are basically consistent with what you saw in the news for Long Island. And then the back to school rush in September, we performed about 210 tests, and 3 were positive, about 1.4%. So these were all the testing of the children to go back to college and back to high school and so forth. Now, come the fall, the COVID rapid in-house testing came to life. We needed this because we were having a lot of children that was sent home from school. They were in contact, they needed clearance. We couldn't do a PCR test, which would take about 3 to 4 days to get a result. Kids would never get back into school. So we connected with our lab representative. They got us a Sophia SARS antigen testing machine. We had plenty of tests, and we were able to implement that towards the end of September. And some very interesting results came from that. About the rapid COVID testing, the children tend to appreciate it a little bit more because it is not a deep nasal swab that hurts. It's just a nasal swab on the inside of the nose, and you just take a specimen. You don't go deep inside and hurt the child. The results are fast. You get them in about 40 minutes. And what does that mean? The person knows pretty quickly whether they need to isolate or avoid transmitting the virus to other people. It is useful because it'll help you to determine whether or not you should quarantine. It is useful for leaving to school, college, high school, and it is the exact same test that's used by New York State. And some interesting numbers here, since September 21st until December 28th, RBK Pediatrics, between its 3 offices, performed 2,695 tests. And out of this, 191 tests were positive, which is about 7.2%. Once again, consistent with what you're seeing in the news. And here you can see our nurses happy to perform their tests. Not a complicated test, but it's a complicated device to get. So we were one of the few offices in Long Island that actually had this test. Initially, when we got the unit, we were only able, through some back channels, to get 1 Sophia unit. So we kept it in our urgent care, and the other offices just performed the specimen, and we would bring them down at the end of the day to the urgent care, and we would run all the tests at the same time and then call the results to their parents. Now, each office has its own unit, so we get the results. You come in, we perform the test, we send the patient home, and depending upon that, we call them up afterwards, and we can email their clearance letter or note or determine whether they need to quarantine or not. So we're not keeping the patients inside the office anymore. Moving forward, we had to segregate again the well care and the sick care. As the numbers were rising, we were concerned that we were mixing, people were starting to mix and become a little bit, not as careful as they were in the spring of last year. So we had to break up the offices by well side and sick side. You can see that we put up curtains to help divert the traffic. We try to keep the sick and the testing patients on one side of the curtain, the well visits on the other side. You can see that our waiting room is basically empty, a couple of chairs. We're using that now as a sub-waiting room where we're calling the patients in, getting them into that chair area and quickly putting them into the room. The reason we did that was because we were telling the patients before to come to room number 2. Now, people did not know where room number 2 was, so we had a lot of people just wandering around in the hallways getting lost. So it is better to go to the waiting room, stay there for a minute or two, and then the nurse will come and direct you to the room that you need to go to. The front desk, we have the plastic shields like you see everywhere in the community. And, just like wherever you go, you can see all the COVID precaution signs, step 6 feet back on the floors. And we have our own designated, PPE safety room. The RBK Medical Mass Unit, that also was developed in the late summer, early fall, because we realized that people did not want to come into the building, and we could not set up the tent just for 1 or 2 patients. It was too cumbersome. So we had somebody build a makeshift frame on the catwalk in the back of the building where we put an exam table and all the stuff that we need, some privacy. And we use this for people that are apprehensive at times to come into the building. We're using it now that it's, people are getting sicker. We transformed it into a sick room. We can see the people that are sick there. We can perform some of the COVID testing over there. Downside is now it's getting cold. And when it rains and it gets cold, it's kind of difficult to work out there. We're making the best. We try to put some heat in there, but it's outdoors. It's still cold. And another interesting thing that we did as a paid forward project was the medical students from NICOM, LECOM, and Hofstra. They were coming to our office for their pediatric clerkships. There had been a lot of medical students in the 3rd years and the 4th years that are not able to graduate because the hospitals would not allow them back into the hospital because of fear of COVID. RBK Pediatric stepped up to help teach these students about pediatrics, to help fulfill their clinical experience in order for them to graduate. What these kids learned was how to practice medicine in the turbulent times of COVID. With the mask and everything, we're not seeing a whole lot of illness anymore. We're not seeing any more flus. I don't have ear infections to show these medical students what an ear infection looks like, so I'm reverting to images on the internet. But, they're learning, they're interacting, so that's a good thing. And NICOM is one of the newer schools that we're working with, but we've also in the past worked with Hofstra and LECOM students. Now, what are some of the lessons that we learned from COVID-19? We learned that healthy infants in general, children, adolescents, do very well if they test positive for COVID-19. The usual is that they will recover in a couple of days, maybe be a little bit sick, cold, cough, congestion, and all of a sudden they get better. Some children, however, can become critically ill, but that's children with many underlying conditions, and that's a very, very less common thing to happen. So we still have to maintain vigilance. Like I said, most of the common things happen commonly, so most of the children do very, very well. They need supportive care, rest, and good hydration. We also learned that the virus is heavily contagious. That's why we've seen entire families, wiped out with this coronavirus. It starts with one child, and then 5 other people in the household become positive. We learned that if you quarantine and you maintain good, sanitary measures, you'll be okay. When I was positive with coronavirus in April, I quarantined as best as I could into one room. My children did not test positive. My wife did not test positive. So I guess we were very lucky. We still need to take precautions, wear a mask, wash the hands, stay a distance from people. That's just good, courtesy and common sense. They say vitamin D, zinc, vitamin C may help. The most important thing that I learned from coronavirus is if you're healthy and good medical health in general and you test positive, please do not despair, especially the children. They will get better. Do not despair. Another very, very important thing that occurred at the RBK Pediatrics level is the medical practice transformation. I used to, in the past, call RBK Pediatrics the RBK Titanic. It was a big organization. It was hard to move. It was hard to change. It was hard to, adjust different things without a great deal of effort. Now, because of the technology in the office that we have and the systems and the changes that came across because of COVID-19, we transformed ourselves into the RBK Starship Enterprise. We have adapted a culture of continuous change in the office. That's what's required on the RBK Enterprise. People with old habits and old cultures and old ways of doing medicine cannot function in a continuous culture of change. We've also embraced the culture of the medical team, not just the single doctor. The RBK patients are the patients of the entire practice. We see doctors, the patients see multiple doctors, and we work together to keep your children healthy. With this, we have a dramatic increase in the overall patient satisfaction. And we also have increased physician engagement because of this. People feel better. We don't have that physician burnout. And with all this, we're looking forward to having a much better year in 2021. I'd like to share with you a mural that we have, a photo that's in our offices in all the waiting rooms, where these are the true RBK heroes, from the physicians to the nurses, to the front desk, to the secretaries, scanners, the leadership, the managers, the billing people. Everybody was there the entire time of COVID. We never abandoned everybody. So we are still here moving forward, helping the community. And it was always nice when you saw out of the blue people just dropping these signs on our front lawn, just expressing their gratitude for us to being there to help people. Now, what's on the horizon for RBK Pediatrics? Well, safety is number one in our office. So what we're doing is, besides the, segregating the sick and the well visits like we described earlier, the curbside check-in will continue into the future. We're not going to have a waiting room anymore. We're going to have maybe that little sub-waiting room where people are going to come into, but we're still going to have you check in on your phones from your cars. And then when we're ready for you, we'll just tell you to proceed to the waiting room. And then we'll divert you to the examination room that you will be seeing your doctor in. We have a new online patient portal. I suggest that everybody sign up for it. It's really, really good. And with this, we're going to have live appointment scheduling where you as the mom can look in the schedule and see that I have an appointment available at 3 o'clock and that works for you. You pick that in real time. Just like Ticketmaster. When you would buy a ticket for a concert, you knew what seat you were going to get. Another exciting thing that we're going to be having at RBK is through our urgent care, we're going to be able to administer COVID-19 vaccinations to the adult populations. First for healthcare workers, essential workers, and ultimately for our RBK parents when we get the vaccine from New York State. Right now, all we have is the authorization to do that. We were approved. And once they bring it down to the office level, then we will be able to provide the service. Obviously, the children are not getting the vaccines yet. That's going to be some time. But the vaccines can be given to the older population, children 16 and above, and to their parents. We're hoping to be able to do that. Another exciting project that we have on the horizon is in Comac, we're going to be building out a brand new 5,000 square foot building office that has ample parking. We're no longer going to be dealing with that hill. That's a great thing. It should be ready, I would say, by the end of the second quarter, 2021. We're going to have the expansion in our Bayshore Saxon Avenue office where the urgent care is. We're going to be bringing in the 375 office into that building and expanding it where the daycare used to be. And we're going to have the whole Bayshore under one roof. Hopefully, life will return back to normal sometime soon by the time all these projects come to life. And when that all happens, I guess we can kiss 2020 goodbye. And let's move forward to a greater 2021. I wish everybody a good new year. And this is Dr. Robu signing off.